Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD. It's been a few weeks since I've been here, and I'm glad to be back again. I needed to take a break. I needed to take some time away from this for a little bit, but I've been missing it actually. Tonight in our webinar, I'll be asking or answering your questions. These webinars are never alike, and they're created by you. So Conversations with Marty Ross MD, this Lyme Q&A webinar is created by your questions. And I usually can answer most questions. Sometimes I get stumped. As you'll see tonight, there may be one or two times I get stumped, but I'll try to give you the best responses that I can come up with given the question you have and the knowledge that I have from managing this illness for many years now, it seems. So during the webinar tonight, I am creating a recording, and this recording will be available tomorrow morning. I'll send you an email early in the morning, probably around 6:30 Seattle time, which is Pacific Coast time. I'll try to get that out to you, so take a look for that. At the end of the webinar tonight, I'll give you an opportunity also by going to the treatlyme.net website to actually sign up for next week's webinar. I apologize. There were some technical problems I had with the sign up earlier. There were two emails I had to send out. I had the wrong links in the first one. So tonight we may actually have a little bit more of a sparse crowd compared to what we usually have, which just means I may have time to get through all the questions tonight. That will be a first if I can do that. One other thing. During the webinar, I will be posting your questions. So if you're watching the live version of this, if you're participating live, you'll actually get to see those on your screen. If you are participating in a recorded version, though, you will not get to see those on your screen, okay? With no further ado, let me go ahead and get started. I'm going to go ahead and take and post the first question here. All right. So this is from Deborah. Deborah says, "Hi, Dr. Ross. My hair has been shedding heavily for 8 months, and I've been tested for thyroid and iron. Can Cemento, Banderol, Hutunia, Sida acuta cause hair loss? Have you seen this? Any ideas? Thanks." So in terms of hair loss, everyone, the first things that we always do is to make sure, and this is whether I'm doing Lyme care or whether I'm being a family doctor, as I'm trained to be as a family physician, the first thing that we're going to do is to make sure that your thyroid levels are normal and also that you have good iron levels, okay? The way I like to look at iron is to measure something called ferritin. Ferritin is the storage form of iron, and I like to keep it at 40 or higher. Now, normally 20 or higher is considered normal, but when it comes to hair loss, you want to make sure those iron levels are actually on the higher side. So you want your ferritin to be at 40 or higher, all right? So first of all, Deborah, go back to your doctor, make sure they're giving you, even though they said your iron is normal, that it's really normal, okay? Second thing is thyroid, when it comes to Lyme, most doctors that don't know Lyme are going to measure and evaluate thyroid based on one test, and that is something called thyroid stimulating hormone. Thyroid stimulating hormone is a chemical made by your brain that talks to your thyroid gland and it says, make thyroid, okay? Now, the area of the brain that makes thyroid stimulating hormone is an area of the brain called the hypothalamus pituitary. And for it to make thyroid stimulating hormone, it has to be able to correctly determine, based on its surveying of your blood, whether you have enough thyroid in you or not, all right? Now, the problem is in Lyme, the ability for the hypothalamus pituitary to correctly assess is not always good. Many of you are familiar with the idea that in these webinars I talk about, but those of you that are new, I want you to be aware there's a group of chemicals made in Lyme by your white blood cells called cytokines. And cytokines are good and bad. On the good side, they cause more white blood cells to be made. They draw those white blood cells to where the infection is, and they help those white blood cells work better. Now, that's all great, okay? But in Lyme, unfortunately, the immune system many times doesn't do a good job, and it tries harder and harder, and eventually it makes too many cytokines. Too many cytokines give you all of your Lyme symptoms. In fact, it's probably more accurate to, instead of saying somebody has Lyme symptoms, to actually say they have too many cytokine symptoms, all right? Now, those excess cytokines can disturb your sleep centers. They can interfere with how your hypothalamus pituitary interprets your hormone environment. They give you fatigue. They give you difficulty thinking. So all of your symptoms of Lyme pretty much are excess cytokine symptoms. All right. Now, again, most doctors are taught the only way to evaluate the thyroid is to start by measuring something called thyroid stimulating hormone. And if it is normal, we assume that the brain thinks your thyroid is normal. Now, if the brain thinks that you have low thyroid, it's going to start screaming at the thyroid, and it's going to make high amounts of TSH. All right. So now the problem in Lyme is those excess cytokines interfere with the brain being able to correctly interpret. It's as though that part of the brain metaphorically gets drunk on cytokines. All right. So we know drunks talk, right? They say stuff, but who knows if it's relevant to what is actually the truth. All right. Same with the brain. On cytokines, it makes TSH, but it may not be relevant to really what's happening with your thyroid environment. So if your doctor stopped only by looking at TSH, they may have missed low thyroid, all right? The better way to look for low thyroid in Lyme is to measure T4 thyroid and T3 thyroid. And in addition, ask you if you have symptoms of low thyroid. So symptoms of low thyroid can be cold intolerance. You're the person that has to wear many layers to stay warm. Sometimes can be hair loss. Weight gain can be a sign of low thyroid. Dry skin can be a sign of low thyroid. So if you have symptoms of low thyroid and your T4 and T3 come in a range where there's more room to add. They may be normal, but there's normal range, so we can give more sometimes. Sometimes you still need to give thyroid. Okay, so even though you're reporting to me that your thyroid and your iron is normal, I'm asking you to go back and make sure that they're normal enough the way I would look at them, okay? So you want your ferritin, your iron stores to be 40 or higher. And don't rely on just the TSH to look at your thyroid. They should have measured free T4, free T3. Those are your thyroid. And you should look at what your thyroid symptoms say. Do they say you have low thyroid? Okay. And if so, you might need to correct your thyroid, or you might need to still correct your iron, even though your doctor said it's normal. All right. Now, I know that's all long-winded, but I just wanted to make sure you get those basics covered. All right. All right. So then the other part of your question is, can Cemento-Banderol, Houtunia, and Sida acuta cause hair loss? I have not seen it happen before, and I use a lot of these in my practice. Now, that doesn't mean it's not happening to you, because there is a Dr. Marty Ross rule in medicine. And what that rule is anything can happen to anyone with anything, all right? So what that means is any of us can have side effects to something, even though they're not common side effects, all right? If I were looking at what you're on, the Cemento, which is cat's claw, sometimes has a progesterone side effect, and that could affect your hair follicles and how they function, okay? So maybe the Cemento. The only way to really know if your iron and your thyroid look good, the only way to really know if these are causing your problem would be to stop all of them for about a month, okay? Now, the only problem with that is with your Bartonella. So Houtunia and Sida acuta treat Bartonella, okay? Bartonella, if you're not done treating it, if you're in the middle of a Bartonella treatment, that usually takes 4 to 6 months. If you're not done treating Bartonella and you stop a BART treatment, Bartonella replicates fast. Every 24 hours, it replicates. It grows itself every 24 hours. It will come back fast, okay? And so you'll lose all that ground. So if Bartonella is still active in you and you need to stop these herbs to see if they're causing the hair loss, see if you can get a prescribing physician to actually put you on some antibiotics that treat Bartonella, all right? Lyme, on the other hand, it's okay to stop the Lyme germ treatment for even a month or two at a time, because Lyme grows really slowly. It replicates really slowly, and it can take a month or two before you start having any increased problems from having stopped antibiotics for Lyme, all right? Okay, so I just said treat Bartonella, and many of you may be wondering, well, how do I treat Bartonella? So let me just do a quick screen share here. Many of you are familiar with this site. This is a site where I've written a lot of information about how to treat Lyme. Through here, you can sign up through the webinars by clicking on this Lyme Q&A webinar link up here. Some of you may have gotten to the webinar that way, okay? But in here, you can look and see what I've written about Lyme. It's organized by chapters. So click on the chapters tab up here. And then to figure out how to treat Bartonella, you would click on the infection treatment plans chapter and then scroll down to Kills Bartonella, a brief guide. And in here, I tell you various herbal as well as prescription options to manage Bartonella. All right? All right. Let me go back here. There we are. Oops. They've changed the program platform here for the webinars. I'm still learning how to use it. So I'm glad. I think I am back here, officially back in the right way. Yep, it looks like it's broadcasting okay too. All right. So Deborah, thank you for that question. All right. Let me move that here. And good luck to you with your hair loss too. I know that was rather long-winded, but I wanted to make sure that I took care of answering that correctly for you. All right. Or it's in a way that give you the best information and also to educate other people too. All right, so this is from Jackie. Hello, Jackie. Let's see, I am stressed. Please advise. I live in central New Jersey 24 years ago. 2 ticks, tonsillitis, bronchitis, sinusitis, tracheitis, over and over and over. Doctor gave antibiotics each time. Later, I developed much worse symptoms, have put off treatment post-Lyme diagnosis as per Herc's fear, as I care for many rescue animals. Okay, so I don't see a question there. Let me see if there's a second part to this. Let's see. I need you, Dr. Marty, to be my Lyme doctor. Been trying to be positive. I will start part-time job soon. Need to work for rescue animals and finally begin treatment. 2.5 weeks ago, while driving, I noticed small round object on back of thigh. Had to tug hard to remove. Assume it was a tick. Red mark similar to a mosquito. I think there's a third part to this question. Let's see. Unsure of symptoms new or from current Lyme. What to do? Appointment with local doctor in 1 week. Would you advise 30 days of antibiotics? Which and what dose? Would this keep new strain from creating havoc on my Lyme-infested body? Is it possible to write this out until treatment with you in August? Okay, so I'm going to answer this. So first of all, it sounds like this could have been a tick, but I think to be clear, and I just want to say this for the listeners too, it doesn't sound like you actually saw it to make sure it was a tick, okay? So I'm going to only talk about if it was a tick. And only you know by what it felt like and looked like for sure, okay? But if that was a tick that was attached, I would recommend getting on a tetracycline, either doxycycline or minocycline for 3 weeks, even if you've got chronic Lyme that hasn't been addressed. And the reason is that tick can have transmitted not just Lyme again, but might have also transmitted some other tick-borne infections, of which there's something called Ehrlichia and Anaplasma, also Bartonella and Babesia. And one of the things that the doxycycline does is in an acute setting, it can help prevent reinfection of those or new infections of those as well too. So dox is like the first line choice you're going to use, and I would do it for 3 weeks. I would either do minocycline 100 milligrams 2 times a day, or doxycycline 100 milligrams 2 pills 2 times a day. Now, keep in mind, your regular doctor is not going to agree probably to doing the doxycycline as 100 milligrams 2 pills 2 times a day, because the infectious disease doctors all have information out there saying just 1 pill twice a day is enough. But because it is summertime, or we're coming up on spring summertime, I would suggest not even doing doxy. I would do minocycline. And the reason I'm making that distinction about summertime or sunshine weather is minocycline is easier to take in sunshine. Doxycycline in sunshine can lead to very easy sunburning. Minocycline can lead has slightly increased chances of sunburning, but not as great as doxycycline. So my preference would be minocycline for 3 weeks, 1 pill twice a day, and that's to cover for all the other possible infections like Ehrlichia, Anaplasma, Bartonella, Babesia, and any of the other tick-borne infections that can be transmitted. Doxy or minnow is a good choice to handle those. Okay? All right. Good luck to you, Jackie. And thank you for that question. All right. Let's see where we are here. Okay. Looks like, even I got notice out late and it didn't work right initially. It looks like we got a good turnout here tonight. All right. Good to see all of you, by the way. All right. So, hello, Kit. Let's see. Missed you the last 3 weeks. I missed you, Kit. Actually, I missed doing this. As I said, I needed to take a break. There's times I just need to walk away from this for a little bit, but I'm glad to be back again. Let's see. Do you have supplement recommendations for difficulty recalling words, eye floaters, and joint popping collagen support? Okay, so difficulty recalling words is cognitive function, okay? So thinking function. And so there's a bunch of detailed things you can do, and then there's a simple thing you can try. One of the simple things that can sometimes help with thinking is lithium, but at nutritional doses, not at psychiatric pharmacy doses. Okay, so many of you may know of lithium as something we use for manic depression or bipolar illness. Okay, and when we use it for that condition, we're talking 600 to 900 milligrams one time a day in an adult. All right. But when we use it for thinking, we use it as a 5 milligram supplement that you take 3 times a day. So it's called lithium orotate. That's OROTATE, lithium orotate, 5 milligrams, 1 pill 3 times a day. Lithium is shown in studies to improve the ability for nerves to talk together, or that's called nerve signaling, the ability for nerves to communicate back and forth. And so it can help with thinking. It also has an advantage if you happen to have if somebody has agitation as part of this disorder, it sometimes can help calm that agitation down too. So lithium, 5 milligrams 3 times a day is a simple thing you could try, okay? If you want to do something more complex, which I usually would not advise doing until, say, if you're about 6-9 months into your Lyme treatment and your thinking is still impaired, then you might want to try the following things, okay? So these are things you do later in treatment, all right? Number 1 is the best antioxidant that is made in every one of our cells is something called glutathione. It's used by the liver to detox, and it's used in every other one of our cells to fix things, okay? It's the fix-it antioxidant. So one of the things I would do is start glutathione. I like using a liposomal form of glutathione. Liposomal means it's microscopically wrapped in fat to increase its absorption. And the product I like is made by Research Nutritionals. It's called Trifortify. There's a Trifortify Orange and a Trifortify Watermelon. But 5 milliliters 1 time a day of that, okay? That gives you liposomal glutathione is better absorbed than non-liposomal glutathione. And glutathione gets inside your nerves and starts fixing things, okay? Number 2, I like coenzyme Q10, 400 milligrams twice a day. And that's, but you can only use CoQ10 if you are not on Mepron or Malarone to treat Babesia. You do not want to take it with those 2 Babesia medicines. It'll make them so they don't work, okay? All right, what coenzyme Q10 does is it helps electron transfer within the mitochondria, the energy factories of your nerves, okay? All right. Also, those are the energy factories found in every one of our cells, actually, all right? So be on glutathione, be on coenzyme Q10. And then the third thing I would do is fix the covering of the nerves and the covering of the energy factories in your nerves called mitochondria. And that's to take a compound called NT factor energy. It's also made by Research Nutritionals. And that's made up of the fats that make up the covering of your nerve membranes as well as the mitochondria. So again, mitochondria are the energy factories found in every cell. They can get injured, especially in nerve injury, and make it so you can't think or you have low energy as well too. Now, those 3 things, the glutathione, NT factor, you start at 2 pills 3 times a day for 2 months, and the coenzyme Q10, I really would not go through the expense of all that unless you have already been under a Lyme treatment for 6 to 9 months with antibiotics or herbal antibiotics, and you're just not getting anywhere, okay? Because often just getting the germs under control are going to help your thinking to get better, okay? So a quick thing you could do is lithium, or if you want to do something more extensive, look at doing that nerve repair formula that I just gave you. And I'll show you, I've written more about it. It's a whole article I have about that in the Treat Lyme book as well too, okay? Eye floaters, I don't have a good solution for that. Eye floaters do seem to occur in Lyme. They also occur in other conditions too. So if you have eye floaters, you want to at least make sure that at least one time you have an eye doctor look in the back of your eyeball to make sure there isn't anything else going on. But it can be a condition of Lyme. And the best thing you can do for it is treat the Lyme with antimicrobials, okay? All right. Joint popping and collagen support. Thinking about this, I haven't given something for the joint popping before. One of the things that happens, I think, in Lyme is Lyme likes to survive, okay? And so one of the things it does is it makes a bunch of enzymes that destroy tissue so that it can burrow into things. And so what it likes to do is oxygen in blood is toxic to Lyme. So Lyme likes to get away from blood as far away as it can. So it likes to live in your joints. It likes to live on your joint coverings. It likes to live in your connective tissue. It likes to live in the ligaments that hold your bones together. Okay, so your bones in any joint, like this bone and that bone, they're held together by fibrous strands called ligaments. And those ligaments may get partly broken down by Lyme releasing enzymes trying to burrow into them, okay? So connective tissue, the thing that holds joints together, the ligaments and the joint capsule, there's a fibrous capsule or covering of the joint too, those are rich in something called collagen. And so one of the things you can do is to support the collagen, and that is to use a substance called hyaluronic acid, and that's hyaluronic, hyaluronic acid. And I'm sorry, I'm going to blank on the dose to actually use for that. But hyaluronic acid can sometimes help support the connective tissue as well too. Okay, so those are my ideas for you. I'm going to do a quick screen share here again. All right, now let's see, what am I looking for here? All right, so in my brain, so in the chapters tab, under brain and nerves, there's an article I've written about brain fog and Lyme disease. You can fix it, okay? Read this. This is an article about how to fix the thinking part that you were describing, okay? It has more information about the recommendations I gave you on CoQ10, the NT factor, and the glutathione as well too. Okay, all right. Now, one other thing I want to show you. I know I talked generically about the names of supplements. If you're wondering, what do I use in my practice for curcumin, or for ashwagandha, or for glutathione, the place you can take a look is at my supplement store. It's called Marty Ross MD Supplements. What I've tried to do here is to find products that I think have the best chance of working, because I've chosen companies to provide the products that I know do a great job of finding the most active ingredients, okay? The other reason that I've chosen things and put them in my own supplement store is I want my patients to have access to supplements that tend to have the least amount of harm from the fillers that are put in, all right? So these tend to be the safest and I think most effective ones, all right? So if you're looking to see the research nutritionals products, for instance, that I mentioned earlier, you could go by manufacturer here, come down and click on the research nutritionals tab. I carry 99% of the research nutritionals products. There's a few products I still have to add here that I haven't gotten to yet, but you'll find the Trifortifys, for instance, the Trifortify watermelon and the Trifortify orange are right here. These are the two glutathione products. If you want to investigate to find what do I use for CoQ10, go ahead and search for CoQ10, and you'll see that it's in the ATP fuel, and then there's the CoQ10 power is another way that I carry that as well too. Okay, all right. So just to show you that, that's where you can find the same kind of supplements that I use with my patients. All right. All right. Let's see here. All right. So back here again. All right. Kit, good luck. Thank you for that question. Hello, Val. Let's see. What suggestions do you have for treating Lyme anxiety? Thanks so much, Dr. Ross, for sharing your time and expertise with us. All right. So you're welcome, Val. So a couple of things. I'm going to talk natural, and then I'll talk about prescriptions. All right. So first of all, Lyme can give anxiety, but also if you have anxiety, if it's ongoing, most of the time anxiety, consider if you have Bartonella. And I would look at the list of symptoms that I have. I'll show you the article here in a bit. See if you have a number of those symptoms. If you do, then you might also want to treat for your Bartonella too. Okay. Not all anxiety is Bartonella, but if anxiety is there, I always look, and at least based on symptoms, to try to figure out if Bartonella is part of the picture. All right. Now, if your anxiety is full of panic attacks, then you also ought to look to see if that anxiety is being triggered by Babesia. And you would look at the symptom list and of Babesia symptoms to figure out if you have enough of those symptoms. If you do, you should treat your Babesia too. All right. So just want to be thorough about this. Lyme can give it, but also sometimes ongoing anxiety can be a symptom of Bartonella, and panic attack anxiety can sometimes be part of Babesia. Okay. So just be aware of that. All right. Now, from an herbal standpoint, I like using lithium. I was talking about that earlier. It can take an edge off of the anxiety. So it's lithium orotate. That's OROTATE. 5 milligrams, 1 pill 3 times a day can help take the edge off. The other thing I like to use from a natural medicine standpoint is L-theanine. Theanine, and that's L-theanine, Theanine, L-theanine, comes as a 100 milligram pill. It is absorbed into the brain, into the bloodstream, and then gets into the brain, where it is converted into a chemical called GABA. And GABA has a type of receptor called a GABA benzodiazepine receptor. Benzodiazepines, many of you may be familiar with, are the Valium medicines like Valium, Klonopin, Ativan, lorazepam, Xanax, alprazolam. Those are all benzodiazepines. Okay, so GABA that's produced from L-theanine interacts at the same receptor that Valium and those medicines do. Okay, so it can be helpful for anxiety. And the dose you would do with your L-theanine, it comes as a 100 milligram pill. You can take up to 1,200 milligrams in a day. And the way you would do that is you would take it as 100 milligrams divided into 3 or 4 doses. So for instance, you could start at 100 milligrams 3 times or 4 times a day, and then add as you need to all the way up to 3 pills 4 times a day or 4 pills 3 times a day to come up with 1,200 milligrams. Again, the L-theanine is a 100 milligram pill. All right. All right. So that's what I would do from an herbal standpoint. All right. Now, from a prescription medicine standpoint, we usually like to work with medicines that are the Prozac medicines, the SSRIs, like Prozac, Celexa, Lexapro, those kind of medicines, Zoloft, Paxil. Those are good not only for treating depression, but they help control anxiety. They put a lid on the anxiety, okay? And if that's not good enough, then sometimes I will add benzodiazepines like a Valium, like a Xanax, like a Klonopin on top of, in addition to taking the Celexa or the Lexapro or the Prozac, okay? Now, if you can't do the SSRIs, then the other option are an older family of antidepressant medicines called the tricyclic antidepressant medicines, which include things like trazodone, desipramine, imipramine, amitriptyline. Those are the kind of medicines that sometimes we can use at lower doses also as an alternative to the SSRIs to help put a lid on the anxiety as well too. All right. All right. But don't forget to treat your right infections. Let me just do a quick screen share on that again. All right. So there's in a chapter in my chapters tab, there is underneath this Lyme disease 101 is a chapter on how to diagnose. All right. So if you're trying to figure out if you might have Babesia, take a look at my article called How to Diagnose Babesia. And you'll find as you start reading it that I don't believe in testing because I think testing misses most of them. Okay. And then to figure out if you could have Bartonella, take a look at this article called It Could Be Bartonella or Babesia, the Signs and Symptoms. Okay. All right. So that's what I would recommend for that. All right. Let me go back here. Again. All right, Val, thank you for that question. And good luck to you. All right, let's see here. This is a question from Phil. Hi, Phil. Hold on here, I gotta get a quick sip of water. Let's see. Do you consider cannabidiol, which is CBD oil, useful for treating Lyme disease? Do you know of a conflict for this with Otoba bark and cat's claw drops I'm using? It has negligible THC, and studies have shown it is antibacterial for Staphylococci, Streptococci, but uncertain for Borrelia burgdorferi. Okay, so everyone, Borrelia burgdorferi, as many of you know, is the Lyme germ. Okay. So Phil, it's quite interesting. So I don't, first of all, about interacting with Otoba and cat's claw, I find no interaction problems there. Okay. I am in Washington State here in the United States, and we have had the ability to use medicinal marijuana for years. Okay. So I have a number of my patients that are on medicinal marijuana. And when I use medicinal marijuana, my preference is to do it as CBD oil. All right. Or CBD. All right, so everyone, let me just do a quick marijuana 101. All right, so there's the marijuana plant. All right, and there is the bud, the flowering part, and then there's the green leaves and stems. All right, the flowering part is the thing that people like to use recreationally, and that's why it's called bud. All right, the bud of the plant. That is rich in a chemical called THC. And that is what you have trouble with on drug screens, okay? If they ever have you urinate for a drug screen, you're going to pee out THC, and they're going to say you're using marijuana, all right? Now, in my state, it wouldn't matter. Although, I guess if you're doing jobs that require driving skills and things like that, they might still be able to get you. But we have, in the Washington state, again, we have a medicinal marijuana law. We actually have recreational marijuana here, too. We tend to be a little bit more progressive that way out here. I know Colorado does, and I know there's a number of other states that also have the ability to do medicinal marijuana as well too. And I'm quite sure. I know California has medicinal marijuana, but I think their recreational law is coming, might be operational now too. I'm not quite sure. Anyhow, okay, CBD is a chemical that you can get from the oil that comes from the green parts of the plant. That would be the leaf and the stems. Okay. Now, CBD tends not to give you the high, but you get all the medicinal benefits that THC would give you, all right? Now, the one thing you ought to be aware of, though, when you get CBD oil, there is always some THC in it, all right? So it's you can't get just pure CBD. There's going to be some THC in it, but again, not like the bud of the plant, okay? All right, now, both THC and CBD can be helpful for pain, nausea. They can help with many of the symptoms that people get with Lyme. All right. In addition, there is the possibility that CBD may help kill Lyme. Yeah. All right. Now, Phil, there's a physician up in Canada, a guy named Ernie Murakami. If you were to Google him, you'd find his website. Ernie is a family doc that was treating Lyme until they developed a bunch of charges against him because he was treating Lyme, and they removed his license. Okay. Now, officially, they didn't remove it for treating Lyme. They came up with other reasons to get rid of him, but basically, he lost his license for managing Lyme disease. Now, Dr. Murakami still continues to help people with Lyme, and he's done so by single-handedly help training many naturopathic doctors in British Columbia and the areas up in Canada to treat Lyme, because up there, the NDs can prescribe antibiotics, at least in British Columbia, they are licensed to prescribe antibiotics. And so in British Columbia, it's the NDs that are doing a lot of the Lyme disease treatment now. And a lot of that is because Dr. Murakami has done a great job of training them or helping to train them. But Dr. Murakami also has helped do some studies that are Petri dish experiments looking at CBD on a Petri dish and Lyme. And he's been able to show on Petri dish experiments that it can kill Lyme. Okay, now, the reality is, in my experience, even though I know he showed that on Petri dish experiments, I don't think it's a great anti-Lyme agent. I don't think it does a great job of killing Lyme, okay? You may get some benefit out of it, but I don't think a great job. I don't think it interferes with your otoba bark and your cat's claw, okay? And but I do find it useful, not as a killer, but I do find it useful for symptom management of Lyme, okay? Now, keep one thing in mind about both CBD and THC. Sometimes if CBD is not doing good enough for your pain, THC will, all right? And vice versa, all right? So sometimes THC will do a little bit better than CBD and vice versa when it comes for pain. I use them sometimes to help with seizure disorder that people get with Lyme. In fact, there is some evidence that CBD helps with bad seizure problems in children, all right? That's where it's gotten a lot of interest in terms of having medicinal properties as well, too, okay? I'm trying to think if there's anything else. Oh, one other thing. Be aware that when you're buying CBD on the internet, all right, on the internet, not in a medicinal marijuana state, but on the internet, that is coming from hemp. And hemp CBD may not be as useful as marijuana CBD, okay? A lot of it has to do with getting adequate concentrations of it, okay? All right. So, one last thing. CBD and THC both can impair thinking, all right? So the one problem in Lyme, you already got bad thinking. Many people do, right? And so just be aware, even CBD sometimes can cause some impairment of the thinking, okay? So just keep that in mind as you're using it, all right? All right. Phil, I hope that gives you some good answers, okay? All right. Thank you for that question. Hello, Brenda. Thank you, Dr. Ross. You're welcome. I am currently taking Ceftin 500 milligrams twice daily for Lyme and Bart. Are there any herbs I can add to my treatment? Also, what is your best treatment for a bad herx? Okay. So, Brenda, so first of all, Ceftin is not useful for Bartonella. Bartonella, to treat Bartonella, you need to work with antibiotics that get inside of the germ or inside of cells. And Ceftin does not. Ceftin basically works on the outside of a germ, and that's not going to be helpful for the Bartonella, all right? So in terms of antibiotics that work on Bartonella, the ones that tend to do best are ones that can be intracellular. And for that, I like using 2 antibiotic combinations, or I like using 2 herbal combinations. The herbs I like using are Siddha acuta and Houtunia. I've written an article about those. I'll show you that here in a second so you can get the dosing. They work about 75% of the time. I've got the idea to use both of those from Buhner, as in Buhner herbs. Okay, you may be familiar with Buhner, Stephen Herod Buhner, who is a master herbalist that's done a lot of writing about herbs and Lyme, all right? But when it comes to treating Bartonella, actually my preference is prescription antibiotics because they work about 80 to 85% of the time. You have a little bit better chance they're going to work for you. And I usually like using combinations of at least 2 antibiotics. And so, for instance, you might consider using something called rifampin with Bactrim. Or you might consider using minocycline and rifampin, or minocycline and Bactrim. There's a whole host that you can actually use, all right? And so let me show you an article that you can take a look at to get better ideas. I would look at the article. I lay out a number of ideas, all right? Now, in terms of Herxheimer reaction, things that work to limit Herx all right, so let me step back. So as I said earlier tonight, Lyme symptoms are actually symptoms of too many cytokines. Cytokines are made by white blood cells when they see Lyme, all right? But they're also made in excess amounts whenever the immune system sees toxins from dead Lyme germs or proteins from dead Lyme germs. They'll start making even more cytokines, all right? So Herx reaction can look just like your underlying Lyme getting worse because your underlying Lyme symptoms are really too many cytokine symptoms. And now if you start causing more cytokines to be made, all that can get even worse, all right? So one thing you want to do is limit cytokine production. And the best thing I like to do that is curcumin. Curcumin is a component of the seasoning turmeric. It's not well absorbed though, so you need to take it in a liposomal variety, something that's microscopically wrapped in fat. And I like using it by a product made by Thorne that is microscopically wrapped in fat called Mariva 500. It's a 500 milligram pill, 1 pill 3 times a day. If that's not effective enough, increase to 2 pills 3 times a day. The other thing I like to do in more of an acute setting is to do glutathione. And I talked about glutathione earlier tonight. You want to do a liposomal variety of glutathione too, if you're going to do it orally. And you would do 5 milliliters of a Trifortify orange or Trifortify watermelon once or twice a day. All right. Now, what do? Well, they're a powerful antioxidant that I said earlier can help with liver detox. Okay, so it can help pull those toxins out so they're not triggering cytokines. But also as a very strong antioxidant, it turns down, decreases the oxidizing agents that are triggering the white blood cells to make cytokines, okay? All right? So those are 2 things I would do, and there's a bunch more you can do, all right? So let me show you a couple articles that you can take a look at here. And this is at treatlyme.net. Take a look at the chapter I've written called Herxheimer and Cytokines, all right? And so you've got 2 choices. You can read either one of these. You can read my article called Control Cytokines, A Guide to Fix Lyme Symptoms in the Immune System, or take a look at this article called Herxheimer-Die-Off Reaction, Inflammation Run Amok. In both of these articles, I lay out steps you can take, which include doing the curcumin and glutathione. And there's some other steps you can take as well too, okay? Now, I just want to show you, in case many of you aren't familiar with this, at my treatlyme.net site, there's a whole treatment protocol I have, okay, under this tab. This you don't have to have a subscription to view. And in here, I list the key steps that you want to do throughout your Lyme treatment, okay? And these are designed to lower cytokines and boost your immune system and help you feel better, all right? So number 1, you need to make sure you're getting sleep. And I give you some herbs and prescription options here. The big thing I want you to know about getting sleep is it restores your immune system. And guess what? It lowers cytokines, okay? So you need to do things to get 7 to 9 hours of sleep at night to manage your Herxheimer reaction and lower cytokines, all right? And then here I also talk about control your cytokines throughout your Lyme treatment by taking the curcumin that I just mentioned here, okay? All right, but take a look at this whole treatment recipe I have. It's critical that you follow most of the steps here because getting rid of Lyme requires more than just killing it, okay? You've got to do steps ultimately to reduce the cytokines, and the only way you're ever going to get, which is lowering cytokines with curcumin, getting sleep. If you have too many yeast in your intestines, getting them out because too many yeast in your intestines trigger more cytokines, all right? Anyhow, I talk about all kinds of things in that treatment recipe. Make sure you take a look at that and you follow the steps, okay? All right. Thanks, Brenda, for that question. Good luck to you. Hello, Oscar. Let's see. Hi, Dr. Ross. How should I transition from taking rifampin minnow and Tindamax to an herbal protocol for Lyme, Bartonella, and possibly to keep Babesia in check? Okay. So, Oscar, you could literally just, okay. So Oscar's current protocol, just so everyone knows, the rifampin and minnow together make a good Bartonella treatment. Rifampin by itself is probably one of the strongest things we can use, okay? Now, rifampin also I use to treat cyst Lyme. So many of you may be familiar that the Lyme germ lives in you in three forms. It lives as a spirochete, that's the corkscrew-looking thing you've seen pictures of on the internet. It also lives inside of your cells as intracellular Lyme. And then finally, it also can live as a microscopic cyst form of the germ, okay? All right. Now, the rifampin can treat intracellular Lyme and cyst Lyme. Minocycline treats spirochete Lyme and intracellular Lyme. And Tindamax treats cyst Lyme and possibly intracellular Lyme. All right. Now, so what I want to let you know, you kind of got an overkill regimen here when it comes to your Lyme. You could have treated your Bartonella with just the rifampin and the minnow and not even done the Tindamax, okay? The other concern I have about that regimen, I hope your doctor's been doing liver testing while you've been on this, because both Tindamax and rifampin can inflame the liver. So I would usually not want to use those two together, although sometimes I will. I have been known to do it before myself, okay? So I don't want to be overly critical, but I hope your doctor was doing some liver testing on you, okay? This current regimen, though, was not doing anything for Babesia, all right? So what you could do is go all herbal for everything, and you could do it by just simply stopping the rifampin, minnow, and Tindamax, and the next day, beginning, Banderol and Cemento are the two herbs many of you know are my favorite herbs for managing Lyme. They work 85 to 90% of the time effectively, which is good as any prescription combination. Together, there's Petri dish experiments that show they remove 100% of biofilm, which is a slime layer that covers the Lyme germ, and they treat all three forms of the germ. So Banderol Cemento I would use to treat your Lyme. For Bartonella, if you want to switch to herbs, again, I mentioned earlier, I would do the Houtunia and Sida acuta. And again, though, they work 75% of the time, okay? And then if you want to do something to keep Babesia in check, let's say you've got Babesia handled and you're just using something to keep it in check, you might want to consider doing the herb called artemisinin as a 100 milligram pill. And you might consider doing 3 pills 3 times a day for 3 days in a row and then take 11 days off. All right. The reason I do that is the intestines have the ability to develop an enzyme that can deactivate artemisinin after you've been on it for a while. So if you stop it for those 11 days, that enzyme goes away and then the artemisinin can work well again. Okay. So that's something for you to consider. All right. Now, in terms of dosing and how do you take all these things, let me just go ahead and show you. I'll do a quick screen share again. Chapter on infection treatment plans. And in terms of how to use artemisinin, take a look at the Kills Babesia article. In terms of the how to use the herbs or prescriptions for Bartonella, take a look at the Kills Bartonella guide. And then for Lyme disease, for the Banderol Cemento, you can either look here in the Lyme disease antibiotic guide I have, or I have a separate article on Banderol Cemento. Let me just do a quick search for that. And so I use the article, in terms of the article, I identify them as Otoba and cat's claw. Let me just see if I can find it here. Okay, so the article is called Otoba Bark Extract and Cat's Claw Tinctures, all right? And in here I talk more about why I love these and why I think they work really well. And even the I described the Petri dish experiments that showed that they work really great too. But I tell you how to take it in that article as well too. Okay, all right, let me go back here again. Again. All right, Oscar, thank you for that question. Good luck to you. Hello, Michael. Let's see. Hi, Dr. Ross. Do you use mushrooms in any of your treatments, specifically willow bracket to reduce cellular quorum congregation or biofilm? So, Michael, I haven't used mushrooms for that purpose before. I have to look into that. Sometimes I get questions here in these webinars that give me new ideas to start trying something. I'll have to look into that. I'm just not familiar with using it that way. I do use mushrooms more either as a preventive mode when I'm done with Lyme treatment to boost the immune system to keep the germ from coming back, or I will use mushrooms to boost the immune system if I've got somebody that is getting repeated viral infections, like one after another during the winter months. In the winter months, what I might do in terms of mushrooms is use a mushroom called reishi mushrooms, 400 milligrams 3 times a day. That has been shown to actually improve cellular white blood cells to fight infections, okay? And I usually will have people do it for 4 months during the winter and into early spring months, 400 milligrams 3 times a day. If I've got somebody that I'm trying to use it to boost their immune system to help prevent Lyme coming back, I like using a different mix, which is a 5 mushroom formula. And of those 5 mushrooms, there's cordyceps, shiitake, maitake, reishi. There's a 5th one I'm blanking on right now, but that has 5 mushrooms in it. And again, I use it to boost white blood cell function. And of that one, I would take it as 1 pill 3 times a day, also as a more of a preventive regimen to keep Lyme from coming back. But I haven't used mushrooms in quite the way that you're mentioning here. So I'll have to take a look into that. All right. Thank you for the question. Good luck to you. Hello, Kathy. Let's see. I tested positive for all 4 categories of mold toxins. I've been taking cholestyramine, charcoal, and clay twice a day for 5 weeks following mold remediation in my home. I'm feeling progressively worse. Should I be feeling better by now? I cut back from 3 times a day. Should I cut back to once a day? Okay. So, Kathy, one key question I would have, and I'm not going to be able to have you answer it here, obviously, because of the format here, but my other question would be are you also taking something at the same time to kill mold or to kill Lyme or to kill co-infections? In other words, are you on germ killers that it could also be making you worse, all right? But let's say that there hasn't been any changes there. The only thing that you have done is to take your mold binders. The answer is, yeah, you could be progressively getting worse at this point. So what Kathy is talking about is there is a phenomenon known as mold toxicity, all right? And she had a urine test done by a lab called Real Time Labs, probably Real Time because they're the only one that tests for 4. And Real Times has the ability to look to see if you have 4 different mold toxins in you. One is called gliotoxin. Another one is called trichosethene, which is black mold toxin, aflatoxin, and aspergillus. And these are toxins, aflatoxin and ochratoxin that come from aspergillus. Boy, I'm getting confused here towards the end. But anyhow, so it looks to see, do you have those 4 toxins in you, all right? And if you do, they're probably coming, you either have been exposed to them in your current environment, or you're getting exposed to them outside your living environment, or you were exposed to them way in the past and you just haven't been able to get rid of them, okay? So there is a physician named Richie Shoemaker, and that's Shoemaker, who has developed a whole elaborate science that shows that about 25% of people have a genetic predisposition where they are programmed in a way that they cannot get rid of mold toxins once they breathe them in or drink them in, okay? 25% of people, all right? That's even people that don't have Lyme. This is 25% of all people cannot get rid of mold toxins once they get in us, all right? And so what's supposed to happen in 75% of people is our immune system will see the toxins in the blood and will tag them for removal. They get broken down. They go to the liver transforms them broken down from fat-based to water-based. They get moved out into the intestines as a water-based substance, mix in our poop, and we poop them out. Okay, that's what's supposed to happen, right? Now, in 25% of people, what happens is they don't get tagged to be broken down. They go to the liver as a fat-based toxin, fat-soluble toxin. The liver can't transform them, and they come out of the liver still fat-based, and they go out to the intestines where they don't mix in our poop well, and they get reabsorbed again back into the bloodstream, all right? So it's a swimming pool of toxins you just can't get out of. You're swimming in toxins, all right? And those toxins are seen by the immune system. They can't get rid of it. And the immune system reacts by making more cytokines. Remember that word cytokines. It's what gives you all the Lyme symptoms. Too many mold toxins and you give you all those cytokines as well too, okay? All right, so what you need to do when you have too many cytokines or mold toxins in you, you need to bind them to get them out. And Shoemaker would have us all use cholestyramine. Cholestyramine is a prescription anti-cholesterol medicine that binds cholesterol, which is also a fat, but you can use it also to bind mold toxins. All right, but you're not only are you doing Shoemaker's cholestyramine, which is hard to do just by itself, but you're also doing two other binders at the same time. All right, so I wonder if you're being too aggressive with your binding. And what you might have done actually is just started with the cholestyramine by itself and done that maybe for about a month and then added in your bentonite clay and then eventually added in your charcoal. I would have staggered these things so that you might add something about every 3 or 4 weeks, all right? I think you may be going too aggressively here, okay? And so I would probably just stop. Yeah, I would stop for right now and try to let things quiet down. And then once they have quieted down, I would go back on pick one. I would probably say cholestyramine, but I would start at 1 scoop 1 time a day. If that flares you, I would even stop again, let that quiet down, and then go to 1/2 scoop 1 time a day. And then if you do whatever you tolerate after a week, if you're quieted down, then go up to twice a day, okay? But I think what the problem is by using 3 binders, I think you're just getting too aggressive with your detoxing. It can take a good 3 months or more sometimes to pull all of those toxins out. And I try to do it in a way that doesn't overly flare a person up, all right? Now, the other thing you should be doing to not flare yourself up when you're doing this is be on something that lowers cytokines, all right? So you're going to do the curcumin I mentioned earlier to limit herxheimer reactions. You should be taking that. If you're all flared up, I would be doing it at 1,000 milligrams 3 times a day. The other thing I would be doing is be on the glutathione that I mentioned earlier, and I would be taking that at 5 milliliters, probably if you're this flared up, at 5 milliliters 2 times a day as well too. And that's the Trifortify, either watermelon or Trifortify orange that I mentioned earlier. Okay. So yeah, I think you're just getting too aggressive here. I think it's just ramping up. It's just triggering more and more cytokines. I think you need to pull back, stop, get on curcumin, get on glutathione, and then as that quiets down, go back on 1 binder 1 time a day to start, and then after a week or so, increase that up to twice a day. But go low and slow here. You don't need to clobber yourself this hard. Okay. All right. Good luck to you, Kathy. And thank you for that question, too. Hello, Brittany. I hope you enjoyed your mini break. I did. Thank you. Thanks, Brittany. Let's see. Thanks again for allowing this platform for us. You're welcome. Let's see. I wanted to ask your opinion on the effect Lyme has on weight. Some maintain normal body weight, others gain quite a bit, and some subset of patients lose weight, muscle mass. Your thoughts on this? Okay. So, generally, if people are going to have a problem, it's not with weight loss with Lyme. It's usually going to be more a problem with a weight gain. Okay. Let me talk about weight gain first, and then we'll talk about the weight loss. So weight gain in Lyme can have 2 problems, 2 underlying causes. Number one, when you have Lyme in you, because of these excess cytokines, they can interfere with the brain's interpretation of what the thyroid is doing. I talked about that earlier tonight, right? And if the brain cannot correctly interpret whether you have good thyroid, low thyroid, high thyroid, adequate thyroid, then it may not be adequately telling the thyroid to make the right amount of thyroid, right? If you don't have enough thyroid in you, you can gain weight, all right? So again, symptoms of low thyroid would be cold intolerance. And I mean your core body and your abdomen intolerance, like you've got to wear more layers than everyone else around you intolerance, okay? Dry skin sometimes can indicate that. Hair loss can indicate it. Weight gain can indicate it too, all right? And if you have those or some of those, look at a free T4 and a free T3 I don't advocate doing TSH testing again because it's not reliable when your brain is drunk on cytokines, okay? And metaphorically drunk on cytokines, that is. And so correct thyroid. All right. Secondly, these increased cytokines interfere with a chemical called leptin that is made by fat cells that talks to the brain. And between the brain and leptin, that is what's supposed to regulate your fat cell size. Cytokines interfere with that whole leptin regulation of fat cell size, and you get leptin dysregulation, which can lead to weight gain too. Unfortunately, other than taking things to lower cytokines, the only way to really get at that leptin triggered weight gain is to treat your germs or get your mold toxins out, okay? And it takes time, all right? The other thing that can sometimes help, I just heard about this at a conference, and I have not tried it yet with my patients, but this was taught to me by a colleague of mine that does a lot of mold toxicity issues, is that sometimes doing fasting, where you basically fast for 12 hours at least 3 or 4 times a week, can sometimes trigger the body to become more what's called ketogenic, meaning burning fat, okay? And so one way to do that is to just stop eating, at nighttime. Make sure you don't eat for 12 hours between dinner and when you have your breakfast. If you can do that 4 days a week, if you do it for at least 12 hours or more, you've made the body start burning fat as its fuel source, which can help with weight loss, okay? The other way to do it is to, instead of doing that four times a week, 12-hour fasting, one other way to do it is to just do a complete fast, fasting water only 1 day out of every 7 days. You could do that as well too. Okay, it's a little bit harder to do, obviously. All right. So those are some thoughts about the weight, thyroid, or the cytokines causing leptin dysregulation. All right. All right. Now, terms of weight loss, sometimes in Lyme, that is due to medication side effects lowering your appetite, all right, or giving nausea. Sometimes it can be due to muscle mass loss. I do agree with that as well, too. But finally, if you've got somebody that is just ravenous, they're eating all over the place and they still can't gain weight, sometimes that can indicate that somewhere in their life they might have picked up parasites in the intestines that are devouring all those calories that are going in, okay? So in that kind of a situation, sometimes I will treat for parasites as well too. Even if stool testing is negative, if I got somebody that is hungry as all get out, they're losing weight, they've done international travel to someplace they might have picked up parasites, even if their stool studies are negative, I'm going to treat for parasites at times, use something called a linea, 500 milligrams twice a day for 3 weeks. And often that will knock out any parasites and their appetite goes back up. I'm sorry, their weight starts going back up as the parasites aren't devouring all their calories. Okay? All right. Thanks for that question, Brittany. I appreciate that. Oops, let me get out of here. All right. Let's see here. Hello, CJ. Let's see. Thank you, Dr. Ross, for taking my question. You're welcome. Do you find it in your practice that poor detoxers, MTHFR and COMT, I think there is a second part to your question here. There is. I found it. Require lower doses on their meds and supplements? If so, do you have a formula to calculate doses? All right. So CJ, yes, people that have detox issues often do not require the same levels of either prescription antibiotics, herbal antibiotics, or anything that we use for that matter, okay? Unfortunately, there is not a formula to calculate it. And generally what I'm going to do, especially when I've got somebody that's a poor detoxer, I'm just going to start low and slow on everything, especially my herbs. So for instance, I've got a patient in Canada that I manage that had severe detox issues. Before seeing me, she was seeing a naturopath and even an MD, I believe, that just kept dumping antibiotics into her. And she got, she couldn't move. She was having seizures. I mean, it was bad news, okay? It took a long time to get her detox to the point that we could start using things again. But when I did start using antimicrobials with her, we were only able to get up to 5 drops twice a day of Banderol Cemento and 5 drops of Houtunia and Sida acuta, for instance. Okay. It's just we had to go really low and slow. Keep in mind that if you are a person that has detox problems, that means you can't remove medicines quickly, all right? And ultimately, what determines if a Banderol Cemento or a Houtunia or a Biaxin or anything we give you is going to work is the amount in your blood, all right? So if you have detox problems, we don't have to put as much in you because you can't remove the stuff as quickly, all right? So I know, for instance, with Banderol Cemento, my goal is to get to 30 drops twice a day. But for some people, that's impossible. There are people that I manage with just 5 drops twice a day. I've even had a person I've gotten better with Lyme on 1 drop 1 time a day. And yes, if you're really a detox, have detox problems, you can start your Banderol Cemento at, you ready for this? A 1/4 drop 1 time a day. How do you do a 1/4 drop? Well, you take your drop, put it in a glass of water, let's say a 4-ounce glass of water, okay? And then divide it into 1 ounces, all right? Each of those ounces has now a 1/4 drop of that 1 drop you put into 4 ounces, all right? That's how you do it, all right? So yeah, so keep in mind what determines your drug level, herb level, prescription drug level, supplement drug level in your blood is how much do you take and how quickly do you detox it out, right? And if this is a problem over here, detoxing is a problem, you don't need to put as much in to get the same benefit, all right? And unfortunately, no, there is no formula to calculate it out. It's all by trial and error. But usually with people with detoxing, I usually start low and slow. Okay, that's the key thing. Usually when I've got somebody that I know has bad detox problems, I'm going to try initially 1 drop on a Banderol Cemento 1 time a day and test it to see how they're going to respond to that, for instance. Okay? All right. Good luck to you, CJ. And thank you for that question. Let's see here. Get rid of that. All right, let's see here. Hello, Jan. Let's see. Hi, Dr. Ross. I'm 77 years old, 11 years with Lyme. I'm sorry to hear about the 11 years with Lyme. Let's see. I am treating Babesia with Malarone 2nd time. First time ended up in the hospital after 18 days with 114 sodium and a heart arrhythmia. Started again 3 days ago and am nauseous with air hunger and vertigo. Is this herxheimer or the drug? Should I continue taking Malarone? All right. So, so Jan had low sodium. Okay, sodium should be somewhere around 132-ish or higher. All right, and 114 is low. That low sodium would give bad fatigue and give you the heart arrhythmia. That's probably where that heart arrhythmia was coming from, or her heart beating abnormally. All right. So Babesia, as many of you know, one of the key hallmark symptoms of Babesia is night sweats. Also, Babesia can give air hunger. Sometimes it can give an off-balance kind of feeling too. I have found at times, Jan, that when you start to treat Babesia, that you can get a worsening of those symptoms. It's not common, but it can happen. The thing I would be careful about with your Malarone is I probably, given the symptoms, I probably would not be doing more than 1 pill twice a day. I know sometimes my colleagues will use more than that. Malarone has 2 components to it. It has a quinine derivative called proquinol in it, and it has a atovaquone in it, which is the same medicine as Mepron, okay? The proquinol as a quinine derivative can irritate the nervous system and could be giving you some of that vertigo. The atovaquone could be giving you the nausea, all right? So if you're taking more than 1 twice a day, you've increased your chances of getting those side effects, all right? So I would play around with the dosing a little bit too, okay? All right. Hope that answers your question. Good luck to you, Jan. Hello, Fiona. Let's see. Had marginally positive IgG IgG test and followed your protocol, but 8-month symptoms of chronic fatigue, low energy got worse. ND tried IV glutathione as you recommend and saw immediate huge improvement. Then got a positive test for West Nile virus, so not sure if symptoms were actually due to Lyme. Let's see here. If not, why did, let's see. Part I'm missing here. Let's see. Oh, I got it. Okay. Let's see. Then got positive test for West Nile virus. So not sure if symptoms were actually due to Lyme. If not, why did 2,500 milligrams of glutathione give such tremendous results? Feel like I'm on road back to health. Thank you so much. Okay. So, Fiona, in terms of determining if somebody has Lyme, and this is for everyone, there's 4 things we consider. Okay. There's your test. Is there a risk of getting it? So are you a person that might have had tick bites, for instance? Do you live in New Jersey and had a tick bite where 95% of ticks carry Lyme? All right, so you consider, is there a risk of getting it? You also consider, are the symptoms consistent with it? And is there anything else that might cause those symptoms? Okay, so could West Nile virus give you symptoms acutely that look like Lyme? Yeah, they could. All right. And then you look at physical exam findings. All right. So I just want to let you know, I would consider all those, and a positive test by itself does not say Lyme disease. You can have false positive tests as well too. All right. Now, there's a common thread between West Nile virus and Lyme, and that is they're called cytokines. All right. So you've heard me mention cytokines a number of times tonight. All right. So cytokines are made by white blood cells when they see Lyme or when they see toxins or when they see any infection. And if they get made in large amounts, those cytokines can give you a lot of the symptoms. All right. So when you were treating your Lyme with everything I had for my successful treatment recipe, yes, there's things we do in there to lower cytokines, but sometimes they don't do enough. And if you had built up a lot of cytokines and you had built up a lot of toxins that kept re-triggering those cytokines, it could be that the glutathione just cleared all of that for you. Okay. And that's why you're doing better. All right. Now, can West Nile virus give you excess cytokines that you can't clear and toxins? Yep. Could glutathione have cleared that? Yep, it could have too. All right. So I don't know. I can't tell by what you wrote here whether I would agree it's West Nile, whether it's Lyme. I would need to talk to you a lot more to figure that out. But the common thread could be if it was West Nile or it's Lyme, they both can increase cytokines. And ultimately, sometimes people just have a hard time getting rid of those. The glutathione could have been enough to remove those for you. Okay? All right. I'm glad you're doing better too. All right, just bear with me, everyone. Let's see here. Hello, Michael. Let's see. Have you ever used bee venom therapy from honeybees? Michael, I have not. I have a number of my patients that do use it. I'm not the best resource on it in terms of why it works or how to do it, though. Okay. I have a couple patients that have had benefit from it. The majority of people that I have had that have tried it do not get benefit, but an occasional person will. So that's the best I can say. I don't consider myself any kind of an expert on it. All right. All right. Good luck to you. Hello, Jennifer. Let's see. Hi from Canada. Hello from Canada. Jennifer, I have a lot of patients in my practice from Canada, being so far north of Washington State. There's a number that come across the border to see me as well, too. Let's see. I tested positive for Lyme using the Ellis spot from Germany. I've been told this test isn't reliable, has false positives by 2 MDs that were not LLMDs. I have also been told it's an accurate diagnosis of Lyme by an LLND, naturopathic doctor. What is your opinion of the Ellis spot? Is it suitable to diagnose Lyme? Okay. So the Ellis spot, everyone, is a method of looking to see if you've had an immune system reaction against Lyme. The Western blot is also another method of saying if you have immune system reaction against Lyme, but they're different, okay? The Western blot looks to see, has your immune system made antibodies that attach to proteins found on the covering of the Lyme germ? All right, so antibodies are proteins that are made by the immune system that attach to Lyme proteins. All right, and once they're stuck on the germ, they act like a big radio signaling tower telling the other parts of the immune system to come in and gobble up that germ. And the other parts of the immune system are white blood cells, including a type of white blood cell called a T cell. Okay, T cells can gobble up germs. All right. So Western blot says, have you made antibodies? All right. What an ELISpot does, it looks to see, have you ever had T cells in you that reacted against Lyme disease? Do you have T cells in you that react against Lyme disease? Okay. And that would mean that they've been turned on because they saw Lyme before because an antibody got stuck on it. All right. So a T cell reaction, ELISpot measures when your T cells from your white blood cells are exposed to Lyme proteins, do they react? All right. That's what an ELISpot is asking. Okay. In the United States, there is a lab called Pharmacin Labs that runs an ELISpot test called an iSpot test. In Germany, Armin Labs does an ELISpot test. All right. Now, there's been studies done looking at the accuracy of ELISpots, and they will find Lyme, if you have it, about 85% of the time. Boy, I'm blanking on the actual false positive rate, okay? But when they do show that, or if you have it, it will find it 85% of the time. And when I've looked at the false positive rate, it's actually quite low before, or something called the specificity, which looks at the ability for it to wrongly diagnose. That's actually quite low, but I'm just blanking on what the number is here. I think it's like 5% or less, okay? So do I consider it to be accurate? Yeah, I do consider it to be accurate, but it's just another way of looking at it, okay? I'd consider it to be as accurate as the Western blot testing is, actually. All right? Good luck to you, Jennifer. Thank you for that question. Oh, in terms of accuracy for diagnosing, just keep in mind that it's considered experimental by infectious disease doctors, by insurance companies here in the States. Not that you have to worry about that up where you are, but well, actually, you have wraparound insurance, so it could be considered to be experimental by your pharmaceutical carrier up in Canada as well, too. All right. So it's not considered mainstream yet, unfortunately. It's considered experimental. Do I consider it accurate? Yes, I do. All right. Thanks for that question, Jennifer. Hello, Casey. Let's see. I'm due for a tetanus shot. Should I get one while I'm still being treated for Lyme and co-infections? Thanks for all you do. All right. So generally, I don't like people getting vaccines while Lyme is still very active, and especially flu vaccine. So with the flu vaccine, which only works, part of the problem with the flu vaccine is it only works about 40 or 50% of the time. Those are studies at the end of the flu season when we like to see how well does the flu vaccine work, 40 to 50% of the time. Okay, so it's not that generally that useful. And I couple the fact that it doesn't work about 40 or 50% of the time with the fact that when Lyme is in a person and active, it makes it get more active, okay? For some reason, flu vaccines, the immune system reacts against that, which allows Lyme to get more active, all right? Now, tetanus shot, I tend not to see, again, maybe the immune system will deal with that tetanus vaccine and therefore not handle Lyme as well. But I tend not to see it give the worsening the way that I see flu vaccines. So I would say if you're in a fairly good place, not a terribly overactive place in terms of your Lyme, if you've been getting better with your Lyme, this is a situation where I say, yeah, it's probably okay to do the tetanus booster, okay? All right. There still is a small risk you might get a little bit worse, but I think it would be a temporary worsening actually with that. All right. Thank you for that question, Casey. Good luck to you. Hold on here just a minute, Patrick. Hello, Patrick. Let's see. Have you heard of the treatment center called Infusio? What do you think of it? I have not heard of that treatment center, and I don't know what I think about it. All right. Sorry about that, Patrick. Hello, Victoria. Let's see. What do you think about Th1 and Th2 in treating autoimmune disease and Lyme? In other words, testing for which is high and which is low. Is that helpful? All right. So, everyone, there's two, as I mentioned earlier tonight, there's these things called T cells, okay? All right. And the T cells, there's certain kind of T cells that get turned on, or white blood. Actually, let me step back. There's white blood cells that fight infections, and there's two types of inflammation related to those white blood cells. All right, there's a type of inflammation called Th1 inflammation, and there's something called Th2 inflammation. Th1 inflammation is inflammation that tends to develop from infection caused by white blood cells attacking that infection. That would be like cytokine inflammation. Okay, all right. Th2 inflammation is inflammation that occurs from more allergies or your mast cells, which are a type of white blood cell that get revved up in infection and in allergies, getting too inflamed too. All right. Now, they're supposed to be kept in balance. Sometimes one gets out of balance versus the other. What's supposed to regulate both of those is a type of T cell called a T regulator cell. All right. And sometimes it can get out of balance. Okay. Now, I don't know how accurate testing is for Th1 and Th2 inflammation. I just don't know. I don't do it. And generally, you can figure out if somebody's got Th1 or Th2 inflammation by what their symptoms are. So if they've got a lot of allergies, they're reacting to everything. They get a runny nose, watery eyes, they have hives, they have rashes. That's Th2 inflammation, all right? Th1 inflammation is usually more if they have infections in them giving it, all right? So I don't know what the benefit's going to be of any of this, actually. I'm not sure what your providers are thinking about doing there, all right? One of the things that can regulate Th1 and Th2 is to do a type of experimental treatment that was quite the rave a few years ago, or even a year ago, called LDI or LDA, low dose immunotherapy. To be honest with you, it's kind of fallen out of disfavor. I still do it on some patients. I'm not going to take the time to go through it now, but I'll point you to an article that you can read about it to see if it's something you'd be interested in doing. I tend to shy away from it these days. Okay. All right. Let me go ahead and show you an article about it. Let me see. I'm going to do a quick screen share. Look at the chapters tab. Look under the immune system. And look at this article called LDI for Lyme, which has some discussion about Th1, Th2, T regulators, and how you can do this thing called low dose immunotherapy to regulate all that. All right. The only problem I've had it with it is that people can, if you miss the dose, if you miscalculate the dose, people can get really sick and not recover well from it. All right. Anyhow, take a look at all that. Okay. Let me go back here. Thanks for that question, Victoria. Hello, Lisa. Let's see. Having fevers that only register on my forehead, 99 to 103, averaging 101. I'm on Doxy and Tylenol. However, under the tongue registers between 96 and 98.6. So the doctors, hospitals say I have no fever, even though I'm sweating, have chills, soaking my pillow, and I'm worn out from fighting fever. Ideas? So if you're using a monitor that's measuring on the skin, just so you know, in general, they're not that accurate. Okay. Now, I'm not denying you're not having symptoms, but in terms of actually measuring temperature, the more accurate way of measuring is under the tongue or an ear thermometer that is actually seeing your eardrum. Okay. Those two could be accurate. All right. So, but notoriously, skin thermometers have a lot of accuracy issues. Okay. Now, that's not to say you don't feel like you have a temperature. Okay. And that is because when you have Lyme and you are herxing, or you just have Lyme and you're not herxing, You make too many cytokines. I've talked about cytokines repeatedly tonight, okay? And too many cytokines give you fever, feeling, and chills, and sometimes even give you fever, all right? So probably a lot of the chills and the sweating and soaking your pillow is coming from excess cytokines. The other thing that can give you that feeling, and you ought to make sure you don't have by looking at my article on it, is sometimes sweats and the chills and fever or this kind of feeling can be a Babesia symptom as well too, all right? So earlier tonight, I showed you how to find the article I have about how to diagnose Babesia. If you're joining us late, make sure you look at the beginning of the webinar tonight and the recorded version tomorrow, or just go to the Treat Lyme site, look in the chapter called How to Diagnose, and you'll see the article I wrote about how to diagnose Babesia, all right? All right. Thanks for that question, Lisa. Good luck to you. Hello. I think I'm probably going to mess up your name here. Yaroslow or Yaroslaw. I'm sorry if I've chewed that up badly. Let's see. My test result was IgG P41 antibody present. Abnormal. Does that mean I might have Borrelia Bartonella bacteria? All right. So the P41, what that is, that's a protein that is found on the covering of the Lyme germ. And they're looking to see, do you have an antibody that attaches to that? Okay. All right. The P41, if you have antibodies that are attached to it, but not attached to enough other Lyme proteins, then that in and of itself is not a positive test for either Lyme or Borrelia. All right. The proteins that we look at, the ones that are most important, are a protein that weighs 23 kilodaltons, or protein 23. All right. So 23, protein 31, 34, 39, 41, or the one called 8393. Okay, so 2325 is one protein, 31, 34, 39, 41, or 8393. Those 6 proteins are really important. And if you have antibodies against at least 2 of those, that's considered a positive Lyme test, okay? So with what you've presented here, the testing itself does not necessarily say you have Lyme or don't have Lyme. It's not technically positive. But again, when you make a Lyme diagnosis, you're actually considering 4 things. One is, do you have enough symptoms? Second is, do you have risk of getting Lyme? Third is, do you have physical exam findings? And the fourth one is, do you have positive testing? All right. So if you have enough symptoms that still look like Lyme, I would reconsider whether you still have Lyme. You still might have it and just not have testing that's showing it. All right. All right. Thank you for that question. All right. So Victoria, it's another question from you. So let's see, if you have low humoral immunity, is that low Th1 or Th2? No. Humoral immunity is about antibodies, actually. Th1 and Th2 are about white blood cells. All right. So antibodies, again, are proteins made by parts of your immune system that attach to germs, versus Th1 and Th2 are about something called cellular immunity, which are the white blood cells, mainly T cells and killer cells that actually attack a germ. Okay. So they're different parts of the immune system altogether. All right. Thank you for that question. All right. So this is States, there's actually 2 schools of thought. Okay. One school of thought says that, or is mainly an East Coast school, the East Coast doctors in the United States tend to do a lot of IV antibiotics. On the other hand, in the West Coast, we tend to do a lot of oral antibiotics. I think the orals work as well as the IV. That's my opinion for most people. IVs will work 90 to 95% of the time. Orals will work 85 to 90% of the time. Okay? All right. So I hope that answers your question. All right. Good luck to you, Patrick. All right, everyone. That's it for me for tonight. So this has been my first return. We did a whole hour and a half tonight. It's great to be back here with you again. There is another one scheduled for next week and one for the week after that. In a second here, if you are still watching, if you're still here, watching the whole webinar, in a minute, you're going to be taken to treatlyme.net, which is also called the Treat Lyme book. When you get there, click on the tab that says Lyme disease webinars and sign up for next week's if you want to do that. All right. The other thing, if you are there, as you know, I have the Treat Lyme book, which has a lot of good information. The way you subscribe for the Treat Lyme book is click on an article that interests you. And if you're not subscribed, you will be asked to subscribe. Keep in mind, when you subscribe, you're supporting this kind of work that I do. Okay. So I'd appreciate that if you would subscribe. And been great visiting with you tonight. Keep an eye out at your email tomorrow morning between around 6:30 a.m. Seattle time. You will get a link, an email with the link to the recording of tonight's webinar. All right? All right. Good night, everyone. I'm just redirecting you right now.